We are concerned that it will be a second epidemic of all these people that will have fallen through the cracks.
Around 5,000 Quebecers are estimated to have cancer but have gone undiagnosed because of the pandemic. That, according to the province's Association of Oncologists and Hematologists.
The first wave of COVID will increase the mortality rate of cancer patients by about up to 15% per year for the next 10 years.
Doctors say a combination of the province restricting cancer-related services and people afraid of accessing the healthcare system are to blame.
A lot of them are actually avoiding doing the regular follow-ups that they would otherwise do in normal times.
Some patients who might have been cured will unfortunately face, on the short run, an heavier treatment program with decreased chances of being cured.
Even though you're afraid, or you might be afraid to go to the hospital, or you might be afraid because you find a lump, or you might be afraid because you're not feeling well, or you have a symptom that's concerning you, you need to continue to pursue it. And you're going to come across probably some obstacles because of COVID-19. It's definitely going to be a little bit harder, but you're worth it.
Obstacles including diagnostic imaging and screening programs for early-stage cancer were halted at the start of the pandemic and have still not been fully restored.
And what patients told us is that they felt abandoned by the system, completely forgotten. It seemed that the government scrambled to protect the health system, but as narrowly defined as only the hospitals. And they forgot about the vulnerable populations in the long-term care facilities. They forgot about the people that were currently being treated for other things. And so now we have these huge wait lines, and the people that are waiting, their situation can get worse.
In Quebec, during the first months of the pandemic, surgeries were only taking place at around 30% capacity, and the backlog of people needing operations has gone up from 75,000 to 90,000. Quebec's 9-point plan for dealing with a second wave doesn't include how they deal with cancer treatment, diagnosis, and operations. But last week, Premier Legault said as regions, including Montreal, moved into a red zone, that if the COVID-19 situation doesn't change in the next few weeks, hospitals may become once again overwhelmed and have to postpone urgent surgeries and treatments.
We've been asking the government to make a plan to address the concerns of cancer patients. How will you prevent the interruption of services? We still haven't had an answer.
In Montreal, Alicia Rubertucci, City News. Quebec reporting a third straight day of over 1,000 new cases.